My name is Dr. Deidre Treschinger. I went to school right here in Kansas City at UMKC Dental School, and I've been a dentist for almost 2 years now. Well, I became a dentist because I really enjoy the technology in dentistry. I just think there's so many fun toys out there with it's always changing. The CAD/CAM technology with same-day crowns is really cool. The laser dentistry that's out there. I just love all the new technology that makes patient appointments more comfortable and easy and fast for them with better results. It's just an always changing field, always something new and exciting to learn about. I just love working here with Dr. Nguyen and his staff. They're just like one big family. We all goof around and get along, but they're also very professional. We have that perfect balance and dynamic where we really build a good rapport with our patients, and they're like part of our family too. Yeah, I think one of the most dramatic changes I've seen in a person as a result of their dental work has been a patient that came in. She was actually, her whole social life was being affected by her smile. She had gone years without seeing a dentist because of her fear of the dentist, and she had kind of been made to feel bad about herself and about her lack of care in the past when she had gone to her previous dentist. And so she came with a lot of dental decay, especially in the front of her mouth where it was very visible. And so she had started even making excuses not to go out with her friends, and just sitting in the chair she wouldn't smile for us even so I could see her teeth when you were talking to her. She was just very ashamed, and we did a bunch of crowns on the front of her mouth because of the amount of decay. That was the necessary work that was needed, but we were able to save every tooth in her head. And when we put those final crowns on, she was just in tears, and she gave me this huge hug, and it made me feel good, and I knew she felt good, and she just could not stop smiling at that appointment. And to see this woman come in that wouldn't barely crack a smile so we wouldn't see her teeth, she couldn't not show it off. It was very dramatic and just very heartwarming. Our practice does some other things like laser dentistry, so a lot of procedures that were done in the past with a scalpel and sutures we are able to do now with a laser. So no sutures, no cutting, and no pain. And patients heal very quickly from that. We also do quite a bit of Invisalign in our practice. So we have a lot of adult patients that never wanted to consider having metal in their mouth at this point in their life that have chosen to do Invisalign to get that straight smile they've always wanted. Well, I was recently married this last summer, so I'm still newlywed, I suppose, for another year here. My husband and I, we love to go out to eat. Who doesn't like to eat? We have a couple little dogs that we like to take for walks and have a lot of fun with them. I have an American Eskimo, and then we just adopted from the shelter a little Chihuahua named Louie. He's a little old man. He's like 12 years old. If a dog can have a walker, that's what stage of life he's in right now. When he came to us, his oral health was so bad, we took him to the vet right away and did his little cleaning, and he was already missing quite a few, but they took quite a few more out, and so his little tongue just kind of hangs out the side sometimes.